Academia is more than research output and publications. In this seminar series, we discuss the personal and social aspects of academic work that are not discussed enough. Welcome to Life in Academia.
Right, so the way we assess people not only has impact on how we do research, but also on us, the little persons doing the actual research. And the big question is obviously, is the current way we do research assessment incentivizing us to do research in the right way, or are there any shortcomings, challenges, and possible solution and changes that we need to effect? And I know David has a few thoughts on this, and that's exactly why we invited him today. David is, objectively speaking, one of the most highly cited scientists in the world, yet he continuously seeks to question and improve the current metric system with certain values that we strive to achieve. In his work, David has, with his colleagues, obviously managed to translate his insights and thoughts into assessment principles, which are more holistic. And these do help internationally to guide individual researchers, research groups, and entire universities to do also question the way they assess their research and researchers, and potentially to adjust their assessment metrics. I am so incredibly happy to welcome David today because, quite frankly, I know too little about research assessment. I know too little about any assessment metrics, and I should know more about the things that I strive for. So please, please, please join me in welcoming David Moher.
Thank you. Thank you very much, Gazelle, for the introduction, and more importantly, thank you for the invitation to speak to your community. And I've put my slides up, so hopefully they can be seen. And I'm very envious of you having a little picture in the bubble. I wish I could have that every day for myself. I could have a lot of fun. Anyhow, let's get on, and I'm going to talk about research and researcher assessment, and hopefully by the end of the talk, you might share this same view that we should hit the reset button. I have no conflicts of interest to declare. In terms of some disclosures of interest, I think mostly it's about some papers that our group have published, so that's a disclosure of interest. So I'm going to sort of put this up first, the first poll question. Are you a faculty member who is assessed regularly? And I suppose it doesn't necessarily have to be a faculty member. It's whether if you're part of a research organization where you are assessed regularly. I think I'm going to have some help with that first poll question. And so I encourage you just to sort of answer that so we can, in a sense, see a little bit of the epidemiology of the audience. So it looks like are people answering the question? Yes.
Yes, they are answering the questions.
Okay, great. Okay, I didn't quite.
They are still answering, and that's
Super.
why I'm keeping the poll.
Right, I should answer that myself, actually. Poll submitted. Thank you for your participation. Okay, so that's great. So, approximately speaking, about half of you are assessed on a regular basis, and obviously then the other half are not. So let's close that poll question, and then I'm going to ask you another poll question. So this is poll question number 2, is what does your assessment include? And in a sense, just click all that apply here. Obviously, this question applies to people who are sort of regularly assessed.
Okay, now I will share the answers.
Thank you so much. Okay, so we can see that everybody here today who is assessed, it's sort of based on the number of publications, the journal impact factor, authorship order, slightly less, the number of grants. You're not assessed based on conducting manuscript peer review. So for example, globally speaking, we spend 100 million hours a year doing manuscript peer review. That's equivalent to 12,000 years, and our institutions are not interested in that. So also, you're not assessed on sharing data, registering your research, or peer review activities. So let's close that. This is sort of fairly standard, I think. And the question is, one might argue based on the results that I've seen today, is that is this a mantra? Publish or perish. And I think based on what we've seen, certainly everybody's assessed on some sort of core pieces of information. And also, I don't know, in a sense, what goes on in Germany. What I can tell you is in North America, university rankings are, people go insane with them. There's usually newspaper articles about it every year when they're released. And they're also, university rankings are also based to a good extent on the number of publications coming from the institution and the number of grants and the amount of money. So just to tell you that this is a serious issue, this is in a cemetery. This is the bottom of a tombstone in a cemetery, and you can see here that this is a QR code linking to a person's publication. So in a sense, although it's part funny, it's part serious. These people are taking their publications to their death. That's how important publications are for some individuals. And I'm a researcher at an institution, and so I will meet with my boss at the end of January, and my boss has sent me and every other researcher, this is how I'm assessed. So I'm assessed on the number of publications in the last 3 years, whether I'm a senior author, first author, and of course they're only really interested in whether I've published in journals with an impact factor of greater than 5. Then they want to know my H index, my N quotient, my M index, the number of self-citations, blah, 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 blah. So that's what extent of what they're interested in. And just down here, we'll see, I'll put on my laser. Just down here, we see it's pretty much the same for grants, but that's what they're interested in. And I'm not going to spend too much more time on that. So the question is my institution unusual, or is that what's going on elsewhere? And so basically, some colleagues and I, we actually asked this in a global context, and we set out to look at the approximately 170 institutions around the world. We asked them 12 questions. 5 of the questions were based on what we might call traditional metrics, number of publications, journal impact factor, and 7 of the questions were sort of based on what we would call progressive metrics, such as, do you share your data? Do you preprint? Do you do journal peer review? And what we found is, across all of these institutions around the world, we found that actually the traditional metrics, as in my institution, really were the most important metrics. So we can say that not only is the institution I'm at highly conservative, but many institutions around the world are likewise conservative. So we sort of can see that although people are publishing a lot, The Lancet in 2014 produced a series of 5 papers about the research spectrum, going from, are we asking the right questions, to what is the quality of research that we're publishing. And so I've underlined sort of an editorial to this series that the editors felt the series provided an opportunity to examine more forensically why academic institutions and other stakeholders were doing what they do, and whether they're getting the most value for the time and money invested in science. So I think they were sort of questioning what is the input and output of our current research ecosystem. And one of the examples is, although it's not related to computer science, it's related to randomized trials, which are very important within the healthcare system. So these authors, this was in Ben Goldacre's lab at Oxford. What they did is in 2015, 2016, they looked at a series of 67 randomized trials that were published in top medical journals, such as The Lancet, the Journal of the American Medical Association, and journals of that so-called caliber. And what they found is that they looked at the 67 trials that were published over a 5 or 6 week period, and they went to see whether the protocol for the research was available. And what they found is that they checked the primary outcome of the study. So let's say improved less depressed people, if it was a study about reducing depression, if it was a study about improving survival. They looked at the protocols for these studies, and what they found is that in 58 of the 67, the primary outcome was switched. So there was a difference between what the protocol said was the primary outcome and what the publication said was the primary outcome. In addition, that there were another 365 new outcomes, novel outcomes, were reported without declaration. They never appeared in the protocol. So these came magically from the sky. And we also, the authors also reported that of the 67 trials, only 29, so approximately only about half, had a protocol publicly available. So we can see in some ways what sort of strange behavior is going on that I could count for my promotion and tenure. It doesn't matter that I may not have told the truth. It doesn't matter where I may have actually lied, or I may have done some other inappropriate behavior. I'm still going to get credit for being promoted and tenured because I published. So that's all that people are interested in, is publishing. So this is some evidence, but this is from 2019. Here is a paper from, I believe it's 2015. This is a very important study where a group of psychologists tried to replicate 100 psychological experiments. And what they found is that on average, the mean effect size, the mean result of the replications was only half that of the original studies. So what the authors here are saying, that of 100 psychological experiments, they were only able to replicate the results less than 50% of the time. And when they did replicate the results, they were half the magnitude of the results reported in the original investigations. So it doesn't matter if I'm assessed the way it is. What matters is I've been able to publish my study. It doesn't matter whether it's not reproducible. And then finally, we have some great examples during the COVID-19 pandemic. Here was a study that was retracted from the Lancet. And why was it retracted from the Lancet? Well, it's quite interesting. This group of authors had some hydroxychloroquine or chloroquine, whether it was a useful treatment for COVID-19. And as you can see, they use a registry analysis. So what's interesting, of course, is that this registry didn't exist. There was no data in this registry. Okay, so this paper got all the way to publishing, and the data didn't exist. So again, does it matter in our current system? Obviously not. They've been able to publish it. They've been able to publish it in a so-called reputable journal with a so-called high journal impact factor. And that's all that matters. They can get their tenure and their promotion. So, and there are many, many other examples I could go to, but I'm not going to spend the time today to go through all of this. I would also like to mention predatory journals and conferences. And this is a report in University Affairs, which is a Canadian magazine of all of the universities in Canada. And this author was very interested in knowing whether McGill, this person was at McGill University, and he wanted to know how many of his colleagues at McGill University had either published in predatory journals or as an editor-in-chief or had some function on the editorial board. And to his dismay, he found that over 200 faculty members at McGill University had made some significant contribution to predatory journals. Again, it doesn't matter, even though it's published in a predatory journal, it's another publication and you can use it towards tenure and promotion. And here is simply just another couple of examples of that predatory publications have leaked into trusted sources. So they've been able to find their way into PubMed and into Scopus as well. And people are obviously using these papers again for hiring, promotion, and tenure. So I guess my question is that sort of given these results, the question is, how are people advancing in their careers? In a sense, they're adopting detrimental research practices and very questionable research integrity. And it's because of this sort of perverse incentives and rewards scheme that we have. Again, they're simply interested in the number of publications. They're not interested in the quality of the publications. They're not interested in whether the publications are telling the truth or not. And they don't appear to be interested in anything else. So the question is, does this behavior promote research integrity? And I would argue, and I hope I've presented some slides that may indicate to you that perhaps research integrity has been sort of diminished. So I wanted to spend the rest of my time this morning sort of focusing on what I think are some useful solutions that you as individuals can use and adapt, and also maybe work on your institution as well. So I would argue that research organizations need to move away from the current perverse incentives. It is very questionable research integrity, and they need to incentivize and reward research integrity. In a sense, trustworthiness. I mean, if there's one thing that science needs is trust. And if the public and other colleagues don't have trust in science, I think we're in a significant downward spiral. And I think part of my solution is also to implement open science practices. So here is the next poll question. And I'm sort of asking you as individuals, not as your institution, whether you have signed any sort of documents promoting best practices, best publication practices. So the DORA and the Hong Kong principles can be signed by individuals. They can also be signed by institutions, but they can be signed by individuals.
Answers stopped. Well, okay, still coming in. Still coming in. Some people are still answering.
Okay.
And I will share the results.
Okay, so that's great. So slightly less have signed DORA, which is, you know, it's more than I thought, to be honest. Slightly less than a quarter have signed Hong Kong principles, but 3/4 of you have signed other documents and promoting best practices. Can I just ask somebody if they would put in the chat or open their mic to what examples would be other documents that have been signed? I'm curious to learn myself, to be honest. That's why I'm asking. Okay, well, I will continue and I can check the chat and see. Okay, so those of you who have signed this, you will know that the DORA is really asking people, promotion and tenure committees, to assess responsible research practices. They're indicating that the journal impact factor says nothing about the quality of research. And this is often a tremendous mistake that I see that some very senior people in universities say to me, well, the journal impact factor, you know, if they've published in the Lancet, it must be a good paper. And of course, the journal impact factor says nothing about the article. It is not a metric about the quality of the article. And so the DORA is a strong movement away from using metrics like the journal impact factor for hiring, promotion, and tenure. And I think there are approximately 20,000 individuals who've signed DORA, and there are approximately 2,000 institutions around the world that have signed DORA. So there is a movement in this direction. And the Hong Kong principles is based on an international effort that was conducted during the 6th International Conference in Research Integrity in Hong Kong. That's where the Hong Kong principles come from. And we have 5 principles, and we were interested in fostering research integrity through the lens of open science. And I'm just going to go through a few of these so you could see how this could be used in your own daily life. One of them, one of the principles is value the accurate and transparent reporting of all research, regardless of the results. And here we're getting at reporting guidelines. So for example, regardless of the type of study that you have, you can go onto the Equator Network, which is a free open access library of reporting guidelines for a great many different types of research in a very wide variety of different disciplines. And so we're really recommending people use reporting guidelines because there is quite strong evidence that the use of reporting guidelines is associated with improved quality of reporting. So here is an example of a randomized trial where the authors were given the use of the consort checklist, and that was that caused, because this is a randomized trial, that caused an improvement in the quality of the published manuscript. Also, we've developed a declaration of transparency for each research article, again, that you as an individual could use. And we're simply asking authors to affirm that the manuscript is an honest, accurate, and transparent account of what went on. And we're doing that in part to remedy some of the results that I shared with you early on. And so here's an example of the Declaration of Transparency that is used in I believe it's in the BMJ. So here, the transparency to the lead author affirms the manuscript is an honest, accurate. It's unfortunate that we have to do that, but it's useful for people to do it. And we also, another principle in the Hong Kong principles is value the practices of open science, such as open methods, materials, and data. And part of the rationale for that is we see an increasing number of patients want their data shared. So it seems to me that in terms of research integrity, that seems to be something very important to do. And as you note that in my institution and other institutions have not been looking at this, but that is undergoing a significant change. And the evidence is that data sharing is associated with added value in terms of citation advantages. And I think that's important for all of us who are doing research. We want to try to disseminate it to as broad and large an audience as possible. Also, the use of preprints. Our group uses reprints, preprints on almost every piece of research we do. And part of the reason for that is that if we're submitting to a journal that's a paywall journal, then at least we make available, openly available, the research that we've done. And in the context of Canada, preprints can also be used in grant applications. So they can be counted as outputs. So another question for the audience is, how many of you register your research, share your data, and preprint your research? And if we could put up the poll question, please. Thank you very much.
I will wait for a couple of more minutes. Okay, and sharing is in progress.
Okay, so that's great that you know, almost 4/5, more than 4/5 of you share your data, and half of you preprint your research, and slightly more than a quarter of you register your research. So I think that that's really good. If I were to do that at my institution, I believe it would be significantly worse. So well done on the folks who are doing that. So I wanted to give you what I think is the perhaps the best definition of open science by that has been promoted, disseminated by UNESCO, which is recognized in 193 nations. And so I've highlighted something here that I think is incredibly important is that a crucial part of open science is sharing of information for the benefits of science and society. And so it's sort of a movement away from me, meaning, oh, I published this number of first author papers. It's not about that anymore. It's about actually, can you bring up the whole community, whether that's the scientific community or bringing up the community in which we live in society. So I think it's very important, and I think we're moving in this direction, and I think all of you can be participants and leaders in doing this. As I mentioned before, one of the principles is value the practices of open science. And we've developed in our own program a number of resources to educate people about data sharing and other aspects of open science as well. And these may be ongoing within your organization or within your country. I'm not sure how many of you know about the transparency and openness promotion. It's called TOP, and it's really looking at standards of transparency. I'm not expecting you to be able to read this. It's really quite small, but you can actually look on the top. You can URL transparency and openness promotion, and it will take you to the Center for Open Science, and you can actually look to see which journals are practicing openness. And I picked up one example here is the example of the Journal of Clinical Epidemiology, and you can see that they don't do very well at the moment in terms of their total score is 1. They don't seem to have any documentation on data transparency, on code sharing and material sharing, but they do appear to have something about data citation. So you can look and see there's thousands of journals that have been rated here. You can sort of see how open are journals. An initiative that a group of us are working on is looking at the openness of academic organizations such as universities or other types of research organizations. And we're asking these 8 questions about what's their view on data set citation, other types of transparency and sharing. And for each principle, for example, we see in terms of data, materials, and code transparency, we can look at the current institutional standard. It will say that it's not documented, and if you meet some basic criteria or some intermediate type criteria or some advanced criteria. So for example, the organization, they say it sets a minimum threshold for the proportion of research that is available according to FAIR principles. So for example, my institution may say that their goal in the next 18 months is to ensure that 60% of the output from the university has data, material, and code transparency. So we're currently working on this for all of these 8 principles, and so that's top for academic institutions. And I think maybe the last poll question I wanted to ask is, does your organization audit best research practices? And so thank you for putting up the poll question.
We are still receiving answer. And I am sharing the results.
Thank you. Okay, so as I would anticipate, the vast majority of people have indicated that their organization does not. So it's sort of quite interesting, because if you were to compare this to a manufacturing plant, you could imagine that, for example, Tesla might have many quality assurances to make sure that they're auditing their manufacturing system. So that's an interesting result. Here is from your own country. This is from Berlin, from the Charité Hospital. They actually, and the Berlin Institutes of Health, they actually are starting to audit their open science practices. And there is some very interesting dashboard development going on in other parts of the world, including in our group. I wanted to leave you with this. This is COARA. It's a coalition for advancing research assessment. These are the commitments to it. This cannot be signed by individuals, but it can be signed by organizations. And I would encourage you that if you're in a position of speaking to your leadership, to bring this to their attention, to see whether they're interested in signing. I believe, although it was only, I've been involved in this, and although it was only finally created, the final product in July of this year, I believe there's something like 350 organizations in Europe that have already signed it. And my last or second last slide is, I think, from this is the outgoing Australian chief scientist, who indicated that people respond to incentives. Change will only come when grants and promotions are contingent upon best practice. And so I think we need to move away from what is very inadequate to best practice. And I want to thank you for the time, and I look forward to having some discussion with you.